Check 1, 2.
Well, hello there, boyfriend. How are you this fine day?
I'm really good.
Is it working?
Yes.
Excellent. Let's not touch shit.
I'm afraid to ask, but I have a great question.
I don't even know what I was going to say. I'm so disturbed right now.
This is very important.
Okay.
This podcast
Yep.
represents the opinions of Dr. Erika and comedian Jamie. The content here should not be taken as medical advice.
Nope.
This is for entertainment purposes only. Every person is unique. Please consult your healthcare professional for any medical questions. Does that about cover it?
Yes, this is absolutely not medical advice.
Speaking of medical questions, man, I'm dying to just jump into. I want to do our new format, 3 questions, get into it. But man, am I dying to talk about, I'm going to have to table this for another episode. I'm dying to talk about what happened this weekend.
What happened this weekend?
Well, maybe I'll just say one of them real quick. We were at a coffee shop yesterday, or a salad shop, and just having conversation. I said, let's try to think of the meanest thing the other person's ever done to us.
Oh, we're going right into it today.
And yours was, we had been dating for 2 months, and I was walking down the street in New York City, and you called me, and I was so in love with you. And I think I had just maybe called my mom and told her about you. And I started to think, this could be like this could be long term. We had said some things. I don't think we'd said I love you yet, but we'd certainly talked about being together for a really long time. And you said, I'm walking through the streets of New York City. I could, if I was a painter, you know, in certain moments in your life, like it just freezes. Like when you're a kid and something traumatic happens, you remember the color of the wallpaper. I could sketch.
Traumatic?
Yes. I could charcoal sketch every little detail of the whole block in New York City when you did this to me. This joke, I said, we're talking and you go, there's kind of something I wanted to talk to you about that we've talked about a lot of stuff in the last 6 months, and by the way, that makes sense because we talked for 6 months. We'd only been dating for 2 months. My dates are not good. We talked for a long time before meeting. So I know we've talked about a lot of stuff, but we never talked about like open relationships.
Nope.
So in my mind, I think she's probably joking and this can't be real. And so I'm walking down the street in New York City. I call you up. We're talking, and you say we've never talked about open relationships. I'm like, And then you go, seriously, like, what are your thoughts on them? Because we never talked about it, and I'm just so in love with you at the time that I'm not thinking straight. This is obviously a bit, right? I don't know. And then you really convincingly say, there's just like this guy, and it's like I don't think it's serious, but like I'm gonna see him tonight. And at this moment, I absolutely believe you. I 100% believe you. And I go, I would not enjoy that. I do not want to have an open relationship.
That's not what you said.
What did I say?
You paused.
Just a gunshot?
While you were drawing your chalk picture forever. And you were like, well, I don't want to see other people. Is what you said.
Yeah. And then, thank God at that moment, you totally let me off the hook. Oh, wait, no, you didn't. You kept going.
Well.
And you said, like, we never talked about it, whatever. And I was just like, and you said I was quiet, but I'm actually surprised you couldn't hear my entire world crumbling behind me.
I just heard tears.
You just heard.
Falling.
I was actually not sad. I was so shocked and upset. Like, not even sad where there would have been. I was just like, I stopped walking. And I was like, should I call my mom back?
Oh, please.
Anyway. And then Erika says, yeah, anyway, this guy I'm going to see, he's Jamie from Gutfeld. I'm going to not talk to you on the phone anymore and watch.
Well, your show was coming on, and I never watched your show. And you had asked me if I would watch your show. You said you like it when I watch your show. So I was like, okay, I guess I will. And I feel like I'm cheating on you with you when I have to hang up the phone to watch you on TV. So I don't like it. So I was like, I'm going to mess with him a little bit and be like,
you were glossing over how traumatic that was for me.
I got to go because there's this guy and he's okay.
Let me ask you a question, Erika. What do you feel like talking about?
Well, don't you like to get messed with occasionally as a comedian by trade? Don't you feel like you're incurring that?
People think that. People think that, and I don't think I do.
But you make fun of other people.
Make fun is very different than act like everything you thought was real is not real.
I teased you.
Okay.
I cheated on you with you.
You know what? In some ways.
He's great in bed.
Good. One of them is. There's something about the feeling when I've said this before, but when you lose your wallet and then find it, it's almost better than never having lost it.
Oh, so I did you a favor, see?
Yeah, so it felt really good.
Oh, she's not interested in other dudes. Yes.
Exactly. Okay. You ready? 3 questions.
Oh, well, I'm sorry I made you sad.
No, it was fine. It was funny. Should we just move on? I was going to make you tell.
You did something mean to me the other day.
Okay.
This weekend.
Hold that thought, but
fine.
We're going to do
questions
bent penises.
Oh, so we can talk about me being
testosterone.
Whatever.
And the honeymoon period.
I mean,
before that,
let's talk about some penises.
But before that, please continue. What happened this weekend?
No, you said you wanted to do questions.
No, I was just checking the cameras. I was just teasing the questions.
Oh.
This is what's coming up. What should we do first? What question first?
We just talked about a penis question.
Bent penises?
You didn't say bent penis. I don't want it now.
Bent penises, honeymoon period, or testosterone? What are we going to?
I mean, I suppose we should lead off with the phallus.
Okay. So now, do you want to say what happened this weekend?
No, I'm so distracted by this.
You want to just do question first?
Well, yeah, I guess so.
I don't know. I feel like that's we can't leave people hang. This weekend.
Fine. You were an asshole this weekend without even knowing it.
This weekend, I had the best weekend of my comedy career. Right? Not saying this to brag.
Woohoo!
Or no, wait. That is what I'm saying.
Yeah, I feel like it.
We sold out 7 shows in Naples at Off the Hook Comedy Club. It was absolutely amazing. And
8 shows in 4 days. That's crazy.
8 shows in 4 days.
That's a lot.
So it's busy weekend is what I'm trying to get at for me. Busy. The phone was on Do Not Disturb a lot of the weekend due to the busyness of the weekend. So I'm on stage. I'll tell you my experience with it, and then you please jump in when you take over.
Mine was fucking great.
I start off early show. It's a sold out crowd. Gutfeld fans. I'm having the time of my life. When in the middle of the set, I start to have what I would describe as chest pains. And I'm talking like, holy shit. Like it starts to come from my arm, like my shoulder area, across my chest on the left side, where a lot of us keep our hearts. And I'm on stage, I still have a half hour to go, and I'm like, wow, this like really hurts. To the point where I had to lean over on the stool and do a half hour of my set. Didn't say anything was wrong. Felt like a clenching, tightening of my chest near my heart. What was I thinking? I'm absolutely having a heart attack. I was like 90%. 90% I was getting. And I was thinking, like, what happens next? Do I just collapse?
Why didn't you get off stage?
I need those views. I need those views on Instagram. I knew it was being recorded.
Well, you should have collapsed on stage then. You would have gotten more views.
Do you know you can't get off stage as a comedian? Like, it takes so... You see guys collapse on stage all the time? Because had I gotten off stage, I would have ruined the show. These people paid their ticket prices. I remember the scarcity years when no one came to see me. I got to do this show. That's why you see comedians collapse on stage. No one ever goes like, oh my... Because for me, spoiler alert, I'm still alive. Everything's fine. I was okay. I would have never gotten off that stage. I would have had to have a heart attack and fall on the ground. But anyway.
Well, you about did.
So I finished the show. Do my meet and greet, 40 minutes, saying hi, taking pictures. And I call Erika. I don't complain that much, right? Honestly, like I'm not a big complainer as far as medical stuff. Like when something's wrong with me.
No, you don't complain at all. I was just thinking how like you also didn't call me this whole weekend because you were so busy. So it was out of the blue. I was like, oh, he's calling me. Like I was at a children's birthday party.
Right.
So when you called, I was like, I wonder why he's calling me. Because most of the time in your shows you do, but this one was a busy weekend. So I was like, is something wrong?
3-show night too.
So I immediately was like,
It was a 3, and you knew it was a 3-show night. I should
answer this. Yes.
So you answered, and I say, Erika, I have a little bit of a doctor question. I'm having chest pains. I don't know what to do. You run me through what I would call, as a layman, a battery of tests.
No, you didn't say that. You said, I think I'm having heartburn.
Oh, yeah. Heartburn.
And then I said, oh, okay. That's all right.
Isn't a burn a type of attack? A heartburn?
I said, where is the heartburn located? And you were like, it's my left upper chest.
Heart
you know
area.
where my heart is located?
Mm-hmm. You immediately sounded concerned.
Of course I was.
You ran me through a bunch of tests, of which I think this is important information. If you're having a heart thing, I learned that if you can press on where it hurts, and if you can recreate the pain, you're not having a heart attack because your heart is behind your...
Yeah, it's buried deep. So reproducible chest pain on palpation. Oftentimes I'll use a stethoscope to trick a patient because if you push and say, oh, does that hurt? They're like, oh, I need to say yes. But sometimes it doesn't.
Wow.
So they can skew the results. So I'll use my stethoscope and just push a little firmer than I would normally with it in my ears, making them think I'm listening to their heart. But really, I'm trying to see if I can recreate the pain. If you can, it's most likely musculoskeletal. So thankfully, when you said, yeah, if I push, it hurts, that's probably... like your pec major, your pec minor, depending on where you were pushing.
I was a pec major in high school. I have a question for you. When a patient says to you, do you ever say to a patient, what's your pain on a scale of 1 to 10?
I do, but I don't like pain scales, but I do.
Okay. Because a lot of times I'll just scream and they immediately prescribe me medicine.
Well, it's incredibly subjective, and a lot of times people will say 20 out of 10, and you're like, well, that doesn't help anyone.
Yeah, that's it.
And then I also have people who have like incredibly high pain tolerances who have had a heart attack. I had a guy walk into my office thinking he was having heartburn. He was lifting weights.
Wow.
I love this patient. I've seen him for years. Healthy guy. He was only in his early 40s.
What were his symptoms?
Mid-sternal discomfort.
Wow.
And he's like, I think it's heartburn. And I was like, not there. You've got to go. I think you're having a heart attack.
So
enough,
where,
and STEMI.
if you feel, for the listener, where would you feel that it would not be heartburn that might be worth getting checked out?
So left-sided chest
Left
pain.
side, not. Heartburn's going to be in the middle.
Typically, yeah.
Is that what you meant by sternum?
Yeah, mid-sternal, right? Your breastbone.
Yes.
So an NSTEMI is a non-ST elevated MI, myocardial infarction. So basically, if he had come into my office and I did an EKG, I wouldn't have seen evidence either. He had to go to the ER and have labs done to show a heart attack. But my point is, someone young and healthy is like, I'm fine. Did you know that women have atypical chest pain very commonly for heart attacks?
Atypical chest pain?
We consider it, they will complain of heartburn when it's really
because they have a higher tolerance for pain?
No, it hasn't been proven as such, but it's an elephant setting on your chest, this pressure sensation.
Wow. I was drunk once and actually had that in college. It was like 2 a.m. There was no one else to choose from.
Trying to be factual, and you're just fucking throwing shit out there.
I woke up with an elephant on my chest. Okay. Very good information. Sternum. Front. That means that's the front of a ship, by the way, the sternum.
No. So anyway, left-sided chest pain, when you said that, was very worrisome because that's not heartburn. But it's very reassuring when you said you could reproduce the pain.
Okay.
Still, I love you. So it's different. Doctors, when it's like a family member or a close friend, we go to the worst thing, the thing that could kill you, not the most likely thing.
Yeah. By the way, I do know a lot about like nautical terminology just from working on cruise ships. It's the stern. Aft. Those are some of the words. I was on a ship once and the captain was like, oh, we have a seaward wind. And I was like, hey, language, seaward? Let's watch there's children here. So we determine that it's not a heart attack. And it's probably, I believe you use the term, I'm going to really try to get this right. I believe you use the term muscle milk skeletor. Muscular skeletophy? Muscular, could you help me out here? Muscular skeletal. Is that right?
Musculoskeletal pain.
Boom.
Almost like muscle milk.
It means you're not dying. And so what happens is, I go, thank you, Erika. I'm really sorry. I have to go do this show. I got to hang up. Thank you. I love you. I can tell you're worried, even though you know it's okay. You tell me to take an aspirin, right? I order up an aspirin. I go in the green room.
Did you end up taking an aspirin?
Mm-hmm.
Oh, that's good.
I follow the doctor's instructions when they're hot.
Well, when they're hot?
Yes. So
if it's musculoskeletal pain, you'd want a non-steroidal anti-inflammatory. But for you, I was still like a 5% chance it could be a heart attack. So we went with aspirin, by the way.
Yep.
Big
my doctor in New York.
Which is also an NSAID, but different. So keep going.
My doctor in New York.
Thought you had a heart attack.
I don't do a fucking thing he says because he's not hot. So I'm in the green room, getting ready for the show to start. They come in. Hey, we're starting in 10 minutes. Coincidentally, Erika's sister just happens to be at my show. She's in Naples, and she's out front. She sends Erika a picture of the crowd, whatever. She's at the show. I kind of know she's at the show. Sitting at the table talking to my opening act, Kelly Collette, and all of a sudden her phone rings, and it says Matt Bergman, who's a comedian we both know. I go, this is fun. Matt just happens to be calling Kelly. I would say 20 minutes had passed at this time. And I go, we'll talk to Matt. And she answers the phone on speaker. Hey, Matt, you're here with Jamie. That's what you say so the person doesn't talk shit about the other person you're with. And Matt goes, Jamie, could you please call Erika right now? Could you please call her right now?
Oh, there was no lead up? I didn't know that.
Yeah, straight into it. And I go, what's wrong?
He's such a nice friend.
I just talked to her. What's wrong?
Him.
And so I look at my phone. 5 missed calls.
Yeah. I called you 5 times? I thought I called you twice.
No, 5.
I thought I texted you twice and called you twice.
5 and 2. 5 and 2. Who's counting? But
both of us, apparently.
I could prove it. But no, I thought it was very... So anyway... I go, what could possibly be going on? I just talked to her. Maybe you remembered something from... The first thought I had was maybe you remember something from medical school.
You didn't just talk to me.
I'm having a heart
attack. You did a whole extra show. You skipped that part.
Oh, I was wrong. I'm bad with time. I thought only 20 minutes.
You just talked to me and said you were having left-sided chest pain, but you were going to go on
minutes.
and you said, but it was so bad that the club even said I could shorten my act because I was having a really hard time being on stage, which you never do. You always go longer for your crowd because you love them. So you shortened it because it hurt so bad.
Yeah.
So you're like, I'm going to go. Then you did another whole 2 hours of like the opener. Then you
asked me that for my penis once if I could shorten it because it hurt so bad. Do you remember? Sorry.
I don't even... Why did you have to go there?
So you're right. I thought it was only 20 minutes. A whole show goes by. You call a bunch of times. I go, what is going on? It turns out Erika's sister was outside, took that picture of the crowd. She's waiting for the show to start. She calls Erika. They're just chatting. Hey, did you go into the show yet? It should be starting about now. Erika's sister says, well, no, they're not starting because an ambulance just pulled up. And then security came out and said they're delaying the show due to a medical emergency.
Inside of the club.
Inside of the club. Show's delayed, medical emergency. I had just called
2 hours before.
What did you, yeah. What did you, and so you thought,
woohoo, Summer! Freaked me the fuck out.
Oh, Summer's your sister. Summer's your sister.
Oh, yeah, my sister. So, yeah, I was really glad that she was at your show, but I thought it was you.
You thought I had the ambulance.
Well, yeah, because it was just a coincidence.
Yeah, just for future reference, the way my insurance is, I would have taken Uber Pool to the
Most
hospital.
people would, unfortunately, in this country.
Yeah. So
ER bills are like $25,000 sometimes for like a one-day thing.
I think I told this story on this podcast, maybe not, but I went to the ER once and it was $9,000 and it turned out I just needed to take a shit. I think I told the story.
That was really why? I don't remember that was the etiology.
Maybe I never told it. It's 100%. They gave me
expensive constipation.
Swear to God, $9,000 and they sent me to the the pharmacy. What's your pharmacy? Oh, I tell them. I go. It's 2 things you can buy. Like it's over the counter.
That's
neither one of them's a prescription. It was like shit yourself tabs. So anyway, it was bad. So you thought I was in an ambulance. You thought my mom will hate to hear this. She'll be mad that even though she knows I'm fine, you thought I was in an ambulance. And then you called me 5 times. I did not answer. And I called you and you were a little upset.
I started crying, but out of relief. No, not upset. I wasn't mad at you. You didn't do anything wrong.
No, not in that sense.
I was sobbing. I was at...
Yeah, upset sobbing is all I meant.
Yeah. It's hard when you get surprised that you're going to lose someone. Like you're not expecting it. And then you just get the phone call of like, there's an ambulance out front and he was having crushing left-sided chest pain of new onset.
Yeah.
Yeah. But you were fine. So I don't think you did it to me, but that sucked.
Isn't it interesting that it didn't really happen, right? It was a non-real scenario. But the worry you felt was real. The concern you had was real. And it made me, when I heard how upset you were, I thought, I know you care about me, but I was like, holy shit, this is like this could really happen where something happens to someone at any point. And it really made me...
What did you say?
No, it just made me think about real things that have happened in my life and people's lives and how I just made me be grateful for life, even though it wasn't a real thing.
Well, I just thought it was funny how like afterwards your friend was like, wow, she really loves you. And I was like, what the fuck? Was this like a setup? Like that's what it was? You were just trying to prove my allegiance?
Yeah.
What are you doing next week?
With flying colors. You know what's funny? You know how
struck out on me?
You know how narcissistic I am?
Are you going to study like up-to-date WebMD, and be like, whoa, I should have these symptoms to scare the crap out of her.
No, you
Jamie
passed.
has leprosy. No, he doesn't. We can still have sex. I'm not going to be like, yay.
You know what a narcissist I am? Whenever I tell someone this story, because it's kind of crazy, they go, wow, why was the ambulance there? And I was like, yeah, I don't know. I forgot. But it turns out it was a drunk person who was an older person.
A drunk guy caused me significant anxiety.
And they went to the hospital, came back to the
He
show.
did?
That's what I heard. That's the update.
What a badass.
Yeah. Do you know I was at a Rob Schneider show once? Middle of the show.
It's actually kind of impressive that he returned.
Please stop me if I've said this on this podcast before. Please really stop me. But I'm on stage opening for Rob Schneider once, and I feel some kind of crazy thing happening in the crowd. Heart attack. They remove a guy as Rob Schneider's about to get on stage. 20 minutes. They remove a guy. He goes to the hospital. You guys are good. He's back at the Late Show.
What?
Same night. I mean, maybe.
Did he really have a heart attack?
Good question.
If he had a heart attack, he wouldn't have been discharged.
I don't know.
No, he would have stayed overnight. They would have given him a lot of different medications and run other tests before they sent him home.
He had whatever I had, those words you said. He probably
had acute coronary syndrome.
I was thinking that, or he had scholastic muscle memory. Right?
Just let it go.
So, I'm okay. And, but it was it was a grateful moment where I thought about life and things like that. You ready for a question?
Yeah, let's please move on.
This question's coming from Tom from North Carolina.
Hi, Tom.
So, look, I was just wondering.
Sorry about that. Technical difficulties. Trying again.
Lissow, look, I was just wondering if it's demasculating at all to date a woman who knows more about vaginas than you and has seen more vaginas than you.
Okay. Wait a second. You've seen 2 vaginas?
I think that's not that funny of a joke. I think that it would be more demasculating if I had seen way more penises than anyone's typical sexual partners had.
Agree. Do you know what occurred to me this weekend? I'm really opening myself up for... I feel like I must have an okay penis. Because even though you're not a penis doctor, I've seen some, and mine somehow passed the test to be part of your life.
Well, it's connected to you. It's not like I can interchange it.
Okay, not exactly the compliment I was searching for. So this is is that not a good should I not feel good about that? I just thought let's just move on.
I don't think it's demasculating.
No, I don't. I totally agree.
Yeah, no. I mean, that's my line of work.
Right.
If I was an accountant and I'd seen a ton of penises and vaginas, I think
that would be terrible.
I think that'd be a little concerning.
That would be very suspicious. Great point. So this guy who left that joke message left a real question. Tom from North Carolina.
I think it's funny.
Listen, hey, I realize that you and your girl are doing this show and you're experts on stuff. Listen, I had a argument with my wife. I was watching a commercial. It was for a drug that helps fight Peyronie's disease, which they kept saying bent penis over and over and over, like a bunch of times in the 30 seconds. And I was like, Anyway, so I was like, isn't that normal? Like most guys are bent one way or the other, right? They're not just dead straight. And she got all mad. She goes, well, how would I know? And I said, well, you've seen a lot of dicks.
Oh.
What? Between me and you, you're the dick expert. And then she got mad at me.
Seen a carousel?
I don't really think that's an insult, is it? I'd love to know your thoughts.
Okay, first of all, where is he? A skating rink?
Carousel?
Let's just go with the
children's museum.
I thought it was a carousel. I swear it was like a crazy carnival. So I think the most important part of the question is that real Peyronie's disease?
Peyronie's is essentially where there's scar tissue, and it can affect any part of the penis.
I like Peyronie's with a little bit of red sauce.
That's disgusting.
Sausage on the side.
That's really gross.
Peyronie's. It's a Polish dish.
How does that not gross you out by just saying it?
Sorry.
The next time you put sausage in your mouth, I'm going to remind you that it's a penis.
The next time you put sausage in your mouth, I hope it's mine.
That?
What is it actually called?
Peyronie's.
Okay.
It's PEYRONIES.
Yeah, just not like it sounds. So what is that disease?
There's scar tissue. You have sclerotic tissue. It scars down the penis, so it can curve it. And
from
over
what?
time, well, it's actually unknown. A lot of times we think that it's from aggressive sex or injuries.
I got some scarring in there.
Or repeated injuries, but the majority of patients who have it actually say that they don't have any recollection of what caused the inciting event.
Do you know why I think I have some scar tissue? Not even joking. Do you know why? That time I had that elephant on my chest.
Circumcision?
No, that elephant on my chest.
God.
There's a weight limit on this thing. I thought about adding a sign at one point that said, hey, just put a scale, less than 200 pounds.
Well, the scar tissue is not circumferentially equal, so you'll have a curvature depending on where it is.
So you're saying it tightens up beside pulling it down? The scar tightens it?
So it can shorten a penis. It can make erections difficult or impossible to achieve, depending on the severity.
All right.
And it can cause a minimal or a substantial curvature to the penis. So you could have barely any change.
Really?
Or you could have a really curved penis, which also affects your partner because it can make penetration uncomfortable.
I think I saw a guy. I've seen very few other penises, but I think I saw a guy with a very curved penis. He was standing at a urinal and he was peeing in the one off to his left. And I thought, that guy's got some scar tissue.
Well, when it happens, the most aggressive form, it's usually within like the first year or so. Mm-hmm. You'll just have surgical treatment.
Is he right that all or most penises do curve? Because you've seen some penises.
I've seen a lot of penises, Jamie.
What do they mostly curve?
I've also touched them.
I feel like mine's straight. I'm not. I didn't pull a level out or anything.
Do you want me to comment on your penis?
I don't know. Don't you think it's straight? I feel
I'm not going to comment on your penis right now.
All right.
In my line of work, that's what we do. I've done a lot of genital examinations. Do most of them curve? I wouldn't be able to tell you a percentage of how many do or don't.
I also think because you're attractive, at that moment, it might curve away and because it's shy. Like, oh, look how hot she is.
Curve away?
Yeah, curve away. Like, oh, don't look at me.
Gross. I don't want to go to work tomorrow now.
So
substantial curvature is atypical, and I haven't seen a lot of it. Minimal curvature or minimal leaning, I should say.
Okay.
Your penis won't just be erect and be exactly perpendicular to the ground.
Right.
Gravity is not like exactly on your side. It might tilt a little way one way or the other.
Good answer. You know what I always wondered? Whenever there's a commercial and they go, hey, it's Peyronie's disease, right? Which is where your penis curves or whatever. Isn't there a list of these people somewhere? They really just play this commercial during the Super Bowl? You don't know. Isn't there like Bent Dick Weekly? You could get a list of subscribers. Why are you telling everybody? Isn't there a way to get to... I feel like it's such a random specific ailment. Sometimes I see a billboard and they like, do you have neuroplastic? And I'm like, don't you know? Isn't there a way to find these people?
Well, I think the other thing that you have to think about is it's very difficult for a lot of people to address that topic with their doctor. They don't like to bring it up until it's pretty significant.
Sure.
So if you advertise it, then people think, oh, wow, it's more common, or maybe it's not a taboo topic. Maybe I could ask my doctor about it. So they'll address it more quickly, swiftly, and appropriately to have treatment sooner, so you don't have to have aggressive treatment when it's progressed too far. So it's kind of nice to be more proactive in that sense. But a lot of guys don't like to talk about their penises.
No. Can it be fixed?
Well, sometimes. I mean, if it's a very mild curvature, why would you want to have surgery, right? There's more risks than benefits in that case. So you have to really weigh the pros and cons.
I would go out looking for a woman with a curved vagina.
That's gross.
Cavity.
I was waiting for that one.
Right?
So she has to accommodate you.
Well, just what are the chances? Maybe she's been looking her whole time for somebody who fits.
That's wonderful. That's great.
Can I hit you with one more question before we have to go? I know we only got to 2 questions today, but we're just in a hurry. Next time on Afraid to Ask, we're going to be talking about the honeymoon period.
Ooh.
Which I think you're...
out of.
Do you know there are times when I know we're not joking, and one of my follow-up questions was... Maybe we talk about this next time.
Wait, hold on. Are you going to draw this in chalk right now?
Traumatic. I was going to say, can 2 people come out of the honeymoon period at different times?
Of course they do. I find that it's very rare when it's simultaneous, unless it's like a major event that causes them both to go, whoa. Like maybe they both get extensive food poisoning, Montezuma's revenge, and they're like barfing and having diarrhea at the same time on vacation, only one toilet. Well, that honeymoon phase ends quickly.
Well, I lied to you about something.
What did you lie to me about?
I just completely lied to you.
You're not in the honeymoon phase either?
No, I am. And I pretended I wasn't to fit in.
Was that the lie?
Yep.
Oh, you lied that you're not in it, but you are in it.
Yeah, like you were like, oh, isn't it crazy how now our chewing annoys each other? And I was like, yeah, God, it's so annoying. And I hear you chewing. I'm like, oh, that's the person I love chewing. It doesn't bother me. It only bothers you. I lied to you. It doesn't bother me at all. Nothing bothers me.
I'm excited to talk about this, though, because I actually think it's better to be out of the honeymoon phase. But I think there's positives and negatives to both.
I agree. I have a testosterone question. You think you can You want to hit it real quick or you want to wait? How safe are testosterone injections? This is from, hey, by the way, on the socials, you can hit us up. This is Daniel Mixford. Hit us up on Twitter. You can also record an audio on Twitter. That's where we got Tom from North Carolina. Is that a short answer or long answer? How safe are testosterone injections?
Well, I would say it's long only because every patient is different. Testosterone is great for a lot of people. I think it's difficult when you say I have low T. What does that mean? Are you having loss of muscle mass? Are you having low sex drive? Are you having difficulty with achieving, sustaining an erection, ejaculation concerns? Do you just feel kind of like not your best? Are you fatigued? So there's a lot of different reasons that people come in to see me and they ask, is my testosterone low? So if it truly is low and you're not suffering from depression or relationship issues where you're having that as the primary cause of your low libido or your difficulty with erection, for example, testosterone supplementation can be beneficial. There's side effects though. It's sometimes expensive. There's blood tests that go along with it. We like to test the prostate. It can affect your blood tests with like a blood count and liver and kidney function. And also excessive testosterone. And this is the thing that I hate.
Yes, to reflect on what you're saying, it sounds like you're saying if someone really needs testosterone, well, yeah, you should take testosterone. There's going to be risks. It depends on the person. But it seems like what you're kind of saying is to have too much of it. Are there guys that are going, give me some testosterone?
Absolutely.
That medically don't need it. They're just looking for some,
a boost, right? It's marketed as like the man hormone. I hate that because it actually is pretty dangerous if you have it in large amounts. It causes aggression.
Yeah.
It can negatively affect your mood. It can affect certain organs if you're overdosing on it. So I think the easy answer is testosterone is good for people who need it, but it can have negative side effects if you don't need it. So it would be very wise to actually have a workup with your doctor and not just go to some like place on the corner that just offers injections and lets you run away. Testosterone can be pretty life altering, so you don't want to just like get the shot and bounce and be like, yay, I'm gonna have more sex. That's not the way it works.
The way you described it though, it's very hard not to go. As a guy, I'm going, yeah, give me some of that.
Well, women too. Women want increased libido all the time. I have a ton of female patients who come in asking for testosterone because they believe that would be the best thing to maximize their libido potential.
Really?
Estrogen, progesterone, but testosterone, here we go.
I got high
case by case.
I have high libido, but who doesn't want more? Right? Like who wouldn't want, let's take it up a notch. Let's keep going. It's like coffee for me.
People with
give me
fatigue.
More. Yeah, I guess.
Relationships, their partner sucks. I don't want, okay.
I see what you're saying. Okay, great answer. So that's your answer, Dan. We're going to go.
We're going to go.
I know. Sorry that you thought I almost died. I really didn't. I don't think I did anything, but I still feel bad. But to anyone listening, I'm glad you're all here and be grateful, man. Serious shit could happen at any time and change your whole life. I think we sometimes just go about our day like everything will always be the same.
Well, you pissed me off when you almost died. So I have no desire to be with you. Maybe I needed a shot of testosterone.
You never know when someone's going to have a fake heart attack. You're not only out of the honeymoon phase, you're in like the ready to meet someone else and go on another honeymoon phase. No? We'll edit that out. Your answer was just so fast when I said, are you out of the honeymoon phase? You said yes.
Sorry. Would you like to try that over? Try it again.
I was trying to think of a joke and then it didn't work. And
try it again.
You're so far out of the honeymoon phase that the hotel we stayed in for our honeymoon, it's a different hotel now. There's new owners.
You can edit that out too.
Coming up on the next episode of Afraid to Ask.
That's a true story?
You'd be like, I told you to empty the dishwasher. It's true, and I'll tell you who it is when we stop recording, and you'll know who this person is.
Do they feel guilty?
You can Google it, and it'll come up.
Do they feel guilty?
I don't know the specifics.
How quickly after the transplant was the breakup?
Last thread. Boop. No, I don't know. Pretty soon after. But can you imagine?
This was your friend who got the kidney?
Not like friend. I know this person.
Did they say that they wanted to break up for a while and they used the person for the kidney?
I did not.
Happened afterwards?
I did not ask any follow-ups, to be honest. Not a friend.
I have so many questions.
I have met this person.
I have so many questions.
I've spoken to this person, and I've just never asked about this particular scenario because it is so sensitive. But can you imagine if I give you a kidney and you were like, "Could you empty the dishwasher?" And I'd be like, "Oh, sure. How's the kidney I gave you?" Okay. I feel like that would be the ultimate
Yeah, I don't think I could actually be with somebody who gave me their kidney because then they would always leave it over my head.
Hold it over your head, yeah.
Like,
I give you my kidney.